Hi everyone, I've got Dr. Mike Forsythe with me this morning. He's the Deputy Head of Sports Management, Sports Medicine at Return to Play, and he leads their complex state clinic. Um, Concussion is a hot topic for directors of sport at the minute, Mike. As I say, thanks very much for coming on and sharing your expertise. Maybe you could share a bit more about what you do at Return to Play and what maybe tips and advice you'd give to directors of sport.
Yeah, absolutely. And thanks for having me on, Chris. And thanks for the opportunity to talk. Yeah, as you correctly say, concussion is a really hot topic at the moment, both in the media and I guess just in sport in general. Now, what we do at Return to Play is essentially address the issues that come about with regards to concussion. We are heavily involved in education, in talking to people about what to look for so that we can correctly diagnose concussion. There are then obviously guidelines nationally that we will guide patients or students through if we feel as a concussion has taken place, and hopefully take away or assist, should I say, assist with some of those difficulties in diagnosis. And concussion is always tricky because essentially, as we'll all know, there's no perfect test for a concussion. A lot of it is done on signs and symptoms. So there are many situations where someone hits their head playing sports and you don't know. And I think that's where we come in. We work a little bit beyond that, so it's not just the diagnosis and the guidelines, but also looking at those boys and girls usually who have longer, more persistent symptoms, and this can impact not only sport and return to sport, but also academic side of things, mood, general well-being. So that's a really interesting area that we are involved with. I think the general stats are that about 15% of people who suffer a concussion will have symptoms that last beyond around 2 weeks. So it's actually a relatively high number. So we're heavily involved in that in terms of looking at those underlying causes as to why that might be happening and then trying to address those and being quite proactive with that. I think certainly in the past, the feeling with concussion was that it used to be a case of, well, just rest and rest and rest and you'll get better. We've moved a little bit away from that now. We're talking more about rehabbing people, being very proactive, getting involved, and ultimately getting people back to sport as quickly as we can in a safe way, really.
So, what advice would you give a director of sport or a coach, let's say, who suspects one of their pupils has a concussion when they were playing sport, whether it be hockey, rugby, squash, anything? What should they do first of all, Mike?
Yeah, a really good place to start. I mean, I think the the point that I always like to make in this situation is that a concussion is a brain injury, and therefore it can't be dismissed or it shouldn't be ignored. Now, as I've alluded to already, there's no perfect test for a concussion. In the professional game, players are removed for head injury assessments and undergo all of these cognitive tests and balance tests. That doesn't exist in amateur sport. So really, we would go on the adage of if in doubt, sit them out. So if someone has sustained an injury to the head or an injury where we are concerned a concussion may have taken place, it's really important that we remove them from play in the first instance. Now, that's not saying necessarily that that is definitely a concussion that's occurred, but it's that there's been enough concern that they need to be removed. Now, the reasons for that, as I'm alluded to the longer term risks of a concussion, but there are, albeit very rare, immediate risks. And there are some very high profile cases that have happened, very sad cases that have happened where concussion symptoms have been ignored. A second impact has happened, and catastrophic results have come about as a result of that. So I think that the takeaway point, I think if in doubt, sit them out is a good one to go by. Now that is, I appreciate that can be very difficult, particularly in sports loving children who are, desperate not to be removed from play, but the risks are not worth taking here. So I think if in doubt, if there is a concern about concussion, then just removing them from play is really important.
Yeah, I think without doubt, if anyone took anything away from this, or they were sharing with their academic staff that take sport, it shouldn't be a difficult decision at all. If you've got any doubt whatsoever, it's a game of schoolboy, schoolgirl sport. The health of the pupil is paramount, and take them off. And if they're fine, then you know they could play next week. But yeah, I would agree completely with that. And then, what sort of advice then? Let's say a pupil has been diagnosed with concussion. With what you do at return to play, what is the next stage?
Yeah, absolutely. So we are available at any point after the concussion injury has happened to offer advice and guidance. Now, traditionally, if we look at the guidance that's been brought in, and that was updated last summer, I believe, or the summer before last, in terms of the updated guidance. So generally, it used to be a case of 2 weeks of absolutely nothing, no sport, no activity, and then gradually building up your involvement from that point, and then to return around that kind of 3 week mark. Now, there's been a slight change in the guidance, which has brought it up to date with the most recent scientific evidence. And what that is bringing back or bringing in a little bit of low impact, low intensity sports after the first week. So essentially, the way things should work is that first week after a concussion is all about just more about getting back into normal life rather than doing anything hugely exertional. So we would generally say just nothing that gets you particularly breathless. From day 8, you can get back into some light, low intensity jogging, static bike, swimming. And then we would review again at about the 2 week mark and then bring people back into more formal school sports where we can build things up over that following week and then sign them off uh, when they're ready, not before day 21. But as I said, we appreciate the importance of sport as well, and actually we are really keen to get people back as soon as we safely can. So I think my advice generally is if you've got someone with a concussion, I think the first 48 hours are important just to take things quite easy. We will always talk about the worrying signs to look out for as well. Now, these are really, really rare,
Hmm.
but always worth being aware of. Um, Now, it's not beyond those first 48 hours. Actually, just resting and hiding in a darkened room is not really the way, it's not really felt to be the most effective way forward. And there's lots of scientific evidence that backs that up. So it's about actually empowering people to get back to school, get back to being, a bit of normality within reason. And there are situations where people really struggle with that. They find the lights, the noise, the academic strain of school very, very difficult. And we can advise with that in terms of coming back in a more gradual sense, perhaps.
And then obviously you've alluded to that some people do struggle longer term, maybe they're not getting better. It's affecting their school life, as you said, their mood, their anxiety. You know, if teachers are spotting those symptoms, what advice would you give to them in that situation?
Yeah, absolutely. And I think it is important to be on the lookout for those symptoms because, as you say, they're relatively common. Now, I think my takeaway point from this would be to get help as soon as possible. So all of the evidence suggests that the sooner we start this rehab approach and actually get into the nitty-gritty and what is causing these ongoing symptoms, the better. So all of the studies have shown that those who get access early do better than those who wait and wait and wait.
Mm.
What we are very experienced in doing now is actually looking at what are the underlying causes. So there are various things that will predispose someone to having ongoing symptoms. It may be that actually the neck is involved and actually the neck has been irritated, whether it's been a whiplash injury or not. That can cause headaches, difficulty with balance, difficulty with concentration. Likewise, we can see some issues with your vision and your balance systems. We can address those in terms of being very proactive with this. We've got a specialist concussion physio now that is involved who can offer people really quite bespoke, tailored rehab to get better from this. The other side of this is that, we've alluded to this already, but there's a lot of anxiety related to a concussion, and quite rightly, I think if someone has been used to doing a certain structure, they love their sport, they're playing every week, and suddenly they're told, actually, you can't, and you're feeling unwell because you might have headaches or dizziness or nausea. And then there's everything in the media about the risks of multiple concussions and long-term issues with cognitive function. It is very anxiety provoking. And we hear a lot people say, oh, it feels like I'm never going to get better. And so we're lucky we're in a position where we've seen a lot of this before. We've got that experience and we can advise and reassure from a position of authority, really. And I think it's a very rewarding part of the job is speaking to people who have really struggled for weeks and weeks on end and then being able to turn things around quite quickly.
That's great. And then obviously the final bit I wanted to ask about was the multiple concussions, which you mentioned there, a child gets more than one concussion. What would be your advice around that, Mike?
Yeah, really difficult. It's a really difficult conversation, and we have it a lot. The reason it's difficult is because there's still a little bit of uncertainty about the evidence about the longer term risks, and it's an area every month there's a new research paper that looks into this. So we make sure we're very up to date with the advice. But the feeling is that, what I always say to patients is, I think there's now little doubt um, that having concussions, particularly multiple concussions, can increase your risk of your brain health being affected long term. Now, everybody is very individual. There are lots of different factors to consider there, but it is something we need to think about and actually taking quite an individual approach, speaking to someone, looking at their unique concussion history, what they've experienced, the symptoms that they've got, how long their recoveries have taken is the way forward here. So actually not there's no blanket rule where we're saying, okay, you've had three concussions, you've got to stop all of your contact sport. We actually rather look at someone, as an individual,
Mm.
discuss pros and cons, what we know, what we don't know, and then come to an informed decision from there.
Brilliant. And if directors of sport, you want to signpost them towards your work at Return to Play, or they want to get in contact, what should they do, Mike?
Yeah, absolutely. So, a couple of ways of doing this. So, drop us an email.
Yeah.
That is support@returntoplay.org.uk. Have a look at our website on www.returntoplay.org.uk. And I believe one of my colleagues will be talking at the meeting in March as well. So please do reach out if you would like any more information. We've also got a lot of educational resources for staff, for school nurses, for pupils, and a lot of things that hopefully will just be raising that awareness about concussion, about how to identify it, and then how to manage it moving forward.
That's brilliant, Mike. Thanks very much. And thanks for your time this morning. Really appreciate it.
No problem, Chris. Nice to chat.